Hello and welcome to Caregiver Chronicles. I'm here with my friend Tracy.
Hello.
And we are going to talk to you today about dementia. Tracy, why don't you introduce yourself?
Hi, my name is Tracy. I'm a CNA and CMT. I've worked in nursing homes and the assisted living for many years now, since I was about 19. So it's been quite a while.
So Tracy and I have had the pleasure of working together for a long time now. We have a lot of experience with dementia. I know Tracy, just like myself, has a lot of professional experience with dementia and also a lot of or some personal experiences. Am I right?
Yeah. I've had the pleasure of knowing both sets of my father's grandparents, and one of them of each grandpa. I had a great grandfather and a great grandmother who had dementia. So
yeah, it's actually very common, and we're going to talk about some statistics and some facts. I personally, right now, my grandmother has dementia. My grandfather had it. My great-grandmother had it. And so I've watched several people in my personal life. I've done home care for people with dementia. And I've had the opportunity to see it through various stages from various perspectives, minus the patient. Which I really hope I never do, but life has no guarantees, right?
Right.
So all of our information, or most, is going to come from personal experience, World Health Organization, and the CDC. Tracy, do you have any other sources you'd like to share?
Nothing really different, other than I have a Time special edition on the science of Alzheimer's, which I've been reading.
Okay, so Time Magazine will be another one of our sources. Again, not all of these sources are accurate as of today. Some of these facts are going to have or two ago. The first fact I want to report is that 50 million people worldwide have dementia. That's from the World Health Organization. The CDC reports 5 million in the US, with 10 million new cases every year. And I know some of you might not be sure about how that 5 million in the United States with 10 million cases every year. Well, sadly, people do succumb to complications from dementia, which Tracy and I have both witnessed.
Oh, yes.
And it's pretty tough. Dementia is not normal aging. A lot of people think that it's normal to get Alzheimer's when you get older, and that is just not true. Tracy and I, again, I know we have a lot of experience with dementia patients, but we've also taken care of people in their late 90s, almost 100, who know everything going on and do not get confused and, other than once in a while forgot where they put something, which is normal. Normal people do this kind of thing all the time. Dementia is not normal aging. So I want to add that in there. I want to make sure people do understand that. Dementia is the most common form of dementia is Alzheimer's, and dementia is an umbrella term for many, many conditions that impair cognitive function. Tracy, do you know any of those? Any other than Alzheimer's? Obviously, you must know a bunch. Put you on the spot.
Sorry. Lewy body dementia, which I believe is also what Robin Williams was actually diagnosed with.
Yes, that is the third most common dementia. And that one actually has, in addition to memory impairment, that one can throw off your balance, cause trouble sleeping, and visual hallucinations.
Right.
Vascular dementia is another one. Percent of people with dementia suffer from vascular dementia, which is a deterioration of the brain through, having heart disease and strokes over time. But 60% of all dementia cases are Alzheimer's, and 5% of Alzheimer's cases start before age 65. So early onset dementia is not super common, but it definitely happens. And yeah, so there's that. And there's so many other or conditions that cause dementia. There's frontotemporal dementia. It's changed the behavior because of part of the brain that affects, and you'll see that one's a little different than Alzheimer's because you'll have inappropriate behavior. You might have inappropriate laughter or make inappropriate comments, things like that. Mixed dementia. There's been cases where there have been patients with 4 types of dementia present at the same time. It's very common to have vascular dementia and Alzheimer's, or, vascular dementia and Lewy body disease, vascular dementia and frontotemporal dementia too. And there are reversible causes of dementia. Increased pressure in the brain, medication side effects, hormone or thyroid imbalances, vitamin deficiencies, and infections such as urinary tract infections or bacterial infections in the body can also cause, especially an elderly person, to be to get very confused. And once those other conditions are treated, they become less confused and they do well. And they don't get confused anymore unless, they have more going on. A few other things: Parkinson's, Huntington's disease, multiple sclerosis, HIV, and brain injuries and tumors can also. So there's a lot of talk right now about football. And are you familiar with any of that? The traumatic concussion, CTE?
Right, the repeated concussions that can, I guess it's rewrite your brain and cause brain areas to die. Yeah, I've watched a documentary about it. I don't remember much about it, but they also say that that's how Muhammad Ali was also diagnosed with dementia because of repeatedly getting knocked out.
And I mean, it's scary to think about that. And such a large percentage of the population will have something that could cause dementia. So an important thing is to, try to live the best life you can. Try to eat healthy, exercise. All these things have been to prevent dementia. Now, you can't prevent everything.
Right. I was also looking.
Sometimes things just happen.
I was also looking up that they say treat depression and stay social and try to stay active in your brain, do puzzles such as crosswords or word scrambles or something to keep your brain active.
No, reading even. No, I definitely agree with that. I think it's important. Again, it's not gonna 100%. There's no guarantee that somebody will not get dementia. Guarantee that. But there are a lot of things that you can do to help prevent it. And again, vascular dementia, I don't think we realize the extent of having an unhealthy heart has on our whole body. But we kind of take advantage sometimes of our bodies, and we don't think about, especially with our hearts and medicines and stuff like that affect that, or not medicines, foods that affect our heart. We know high fat foods are not very good for your heart. And that affects you everywhere. That affects your brain. So we have to always take stuff like that into consideration. Please don't eat a bag of potato chips every night. It's not good for you. Another common thing that causes dementia over time is excessive alcohol use. I'm not against drinking by any means. Everybody who knows me knows I like to have a glass of wine or a beer once in a while. But not in excess. I try not to drink all the time. I don't even drink daily. And I think over time that does cause dementia. Unfortunately, I do know a person who was a heavy drinker in their younger years, and even though they had stopped, some of their dementia later on was contributing to how much they drank when they were younger, even though they hadn't drank for a few years. So and if you struggle with that, there is help. There is help.
Yeah.
We can add resources to our social media pages if you do struggle with something like that and you are concerned.
Never suffer in silence. This always help. Always.
Exactly. Thank you, Tracy. Also, if you notice, so some of the most common signs of dementia aren't necessarily, especially in the beginning, they're not necessarily memory loss, and people think that that's what they know. All of a sudden they don't know who I am. No, that phase usually comes a little bit later. One of the earliest signs of dementia is not memory loss. It is struggling, like a change in personality, like not liking to do the things you used to like to do. That can also be a sign of depression. So if you're caring for a family member,
Yes.
or if you have to an aunt, an uncle, a grandparent, and you realize that they used to love to go, and now going to the movies, they don't want to go anymore. Every time you say, "Oh, come on, let's go to the movies. Let's go to the movies today," they don't want to do it. That might be a bad example given a global pandemic.
I find hobbies,
but
tends to be
something
that people will stop doing, like knitting.
Yeah.
Say you're someone always knitted scarves and hats for everybody for Christmas, and then suddenly decides that they're not doing this anymore because they just don't want to. There's no interest.
And that can also be a sign of depression. So if your relative is experiencing, or your friend or somebody, it might be time to take them to the doctor, because the sooner you get the symptoms the sooner you rule out depression with something like this and realize that it may be dementia, the sooner you get treatment. The sooner you get treatment, the better outcome they have for longer. There is no cure for most types of dementia other than reversible. Most of the conditions that is dementia, we don't have cures for. That being said, there are treatments specifically more so for Alzheimer's that you can do that are very helpful. And the treatments are medications. And I'm not going to prescribe, but I will say what they are. And not all medications are suitable for everybody. So again, please go to your doctor. But just for educational purposes, the common medications for dementia are, Tracy, you want to take it away?
That would be Namenda, Aricept. Those are ones we see quite common in the nursing home setting.
And then we also do see people treated with, depending on other things that go on, antidepressants and antipsychotics as well. Again, we are not doctors. We are not prescribing. We are not telling you to go to your doctor to get these medications. We are telling you that if your loved one is experiencing a change in behavior, you need to take them to get them checked out. But that's the first real sign.
Also, I've noticed I also have a grandmother currently suffering, personal care, and not like that they're not dirty, but like they wear the same clothes multiple days. They
Yes.
haven't brushed their hair in a while.
Yep. That's another really big early sign, lack of, because they're not thinking clear enough to do those tasks. Another sign would be accusing people of trying to harm them, or like a more paranoid behavior, because again, confusion, paranoia can come in together. Thinking somebody took something when they didn't. That's another early sign. I think Tracy and I have both seen that.
Yeah.
Multiple times.
And time confusion, when your day and night seems to be reversed.
Yes. That's another one that's very common, or when you're not sure what time of day it is. We've seen a lot of these signs, and just because somebody is having one, is experiencing one of these symptoms, or all of these symptoms that we're saying, all of these signs of early dementia, especially like the loss of liking to do things, or any confusion at all, and it happens suddenly, you need to get them to a doctor right away, because there's a really good chance that it's an infection or something else going on. Sometimes these changes are a little slow, and they kind of happen over the course of weeks to months, more so than days. And if you notice in like 2 days, your mom, let's say as an example, doesn't remember where she put her shoes, and she keeps them in the same spot all the time, that's a sign she needs to go to the doctor immediately. An immediate change in mental status, you need to either be in the doctor or the hospital for that. Because that's
one of the other
of
things that
more serious
I see a lot is like object confusion, like people trying to make phone calls on their TV remotes, or trying to turn off their television with their telephone,
with their phone.
Oh yeah, that one happens a lot. How come this isn't working?
I don't mean to laugh. Yeah, I can't hear anybody. I did have a patient once hand me their remote control and say, I can't hear anything on this damn thing. And I went upstairs, and I went to their room to help them fix, because I thought they were referring to their TV. And I it's fine, of course. And I'm like, no, it's working fine. And they're like, well, why can't I hear the people talking? I'm like, wait. And I didn't realize that they were talking. And finally, I figured out that they were trying to call their daughter, and they couldn't. And so then I helped them with the phone and muted their TV so they could hear. But
sometimes I also find
that, but it's not.
Right? Because I've also had people ask me to turn off the street light in the front of the house, and I'm like, I can't do that.
Yeah.
Like, we have no control over that.
Yeah. Getting angry. If somebody is a generally happy person too, and you notice all of a sudden they get upset a lot faster than they used to, that's another sign that something is very wrong. And again, with all these signs, please don't ignore it, because the longer you wait to get that person help, the worse their outcome. The early detection is, personally, I think that with early onset dementia being so common, and early onset dementia, well, not so common, but a little bit common. It's common in certain populations. I believe Down syndrome is where it's most common in people who already have cognitive impairment. So screening them first for early onset dementia is important. That's kind of something. And then if you have a family history of dementia, or specifically Alzheimer's, you will want to get screened for that as well. Starting probably younger than 65.
I've also found that when you confront a family member that you realize they're having these issues, generally they'll be resistant to you. They'll tell you there's nothing wrong. They'll tell you that they don't want to go to the doctor, that they're fine. They've always been like this. You got to find a way to persuade them. I know it's hard. I know, especially seeing someone you care about struggling and them refusing to go get help is hard and scary, but you got to make sure you get them checked out as soon as you possibly can. It could be a number of things, but again, with dementia, the earlier it's caught, the better you can survive with it, by slowing progression.
Exactly. You know, it is a death sentence to, or it feels like, and it's not necessarily a death sentence, but it feels like one when, you know, you hear so-and-so has Alzheimer's, or so-and-so has this or that or the other thing, and you know nobody has overcome Alzheimer's. Right. You don't necessarily die specifically from Alzheimer's, you do die from complications of it. But
there are a lot of families who will grieve someone who's been diagnosed, and because it's like them dying twice.
Exactly.
You're going to lose them cognitively before you lose them figuratively.
Exactly.
Physically.
And it's hard, and it's really hard to accept that, and it's really hard to get, but or to admit. It's hard for people to admit when they need help. And if you are a caregiver and you're noticing these things, as hard as it is, please just, it's okay. Sometimes it's okay to not be okay. It's okay that the answer isn't a good thing or what you want. But getting that diagnosis getting treatment earlier rather than later can make such a difference. There are other therapies besides medications too that I want to talk about a little bit. Reminiscence therapy is huge. You might maybe show pictures to your loved one, talk about their hometown, their school, their music, their job, their hobbies, maybe when their children are younger. That's a real important therapy. That's a real good one to get them to talk about things, and just important to help stir up as much memories as possible. Music from their past, music therapy is huge with a lot of, I mean, I think you see music therapy in almost everything, but specifically with dementia, if you have somebody who was a big Beatles fan when they were younger, and they didn't really listen to classical music, you're not going to play classical music to jog their memory or to help their memory. You're going to play their favorite Beatles songs, or, you know, whatever their music was that they liked when they were young, or younger. And you're also not going to play Post Malone as music therapy for somebody with dementia either, because chances are, nothing against Post Malone, he's awesome, but
that being said, I did have a resident who had dementia, and she used to put on like rap all the time, and I know she didn't listen to rap when she was younger. I found it hilarious, honestly. We're like, you enjoying this? And she's like, oh yeah, this is great. I'm like, all right.
Maybe she did like the sound of it. I know I had my actually funny story about my grandmother. I had her over, and I was listening to the band Tool, the rock band. They're one of my favorite bands ever. So we were listening to Tool, and it was the funniest thing because even though she had never heard the band before, and you know, she wouldn't remember them, they wouldn't jog her memory, but I was cooking and I wanted to listen to Tool, and she was sitting in the kitchen with me and we were talking. She was tapping along to the music, which is really cool because their music is very their beats, their music is just very intricate in how they play, in like the style and like the note patterns and stuff like that. And it was really cool to see my grandmother just tapping along, who, you know, I knew she was confused and just tapping along to Tool, but if you put Elvis on for her, Elvis was her favorite, and she will sing Elvis. Occupation, but music therapy is huge. That's a huge thing, a huge help. Occupational and physical therapy as well is really important. Physical therapy, just to keep people's bodies and muscles working. The longer somebody with dementia is moving, the longer they'll be alive. I know that sounds kind of harsh, but they're less likely to succumb to pneumonia if they're ambulatory and things like that.
Right.
So physical therapy is important. Just, the ability to walk. And again, exercise is so good for your brain. And occupational therapy, of course, for, activities of daily living, brushing your teeth, washing your face. You need occupational therapy to do a lot of those things. Eating a lot.
Yeah.
A lot of patients with dementia forget how to hold a fork and feed themselves, and occupational therapy does help with that. You'll never get back what you lost, but if you keep maintaining the skills, they'll keep it. And another thing with dementia, the more you have a person do for themselves, the more they'll be able to do for themselves the longer. I think, our job as a CNA is to promote, it's to give personal care and assist with what we call ADLs, activities of daily living, and to promote independence with ADLs as much as we can. Almost never, only in rare cases will I wash somebody's face for them. Most people can, you hand them a washcloth and, okay, wash your face. They need the guiding, the cueing. But as much as I can get someone to do for themselves, I try to promote that. It takes more time sometimes, when we're doing patient care.
Yeah, it can.
But really, in the end, if you, it's just better for anybody in the long run. So,
it's also more about maintaining dignity. The more that they can do from themselves, the more dignity they seem to have, and the less of a burden.
Exactly. And so when you're caring for a loved one, remember that, it's okay to not do every single thing for them, right? Like,
right.
If they don't need you to wipe their butt yet, let them wipe their own butt. If they don't need you to cut their food up on their plate, let them do it. Right. You want to promote their independence. And even if they don't have dementia, and you're caring for somebody who's sick with something else, have them do as much as they can for themselves, because it's just going to help the outcome. Another therapy that's really good for dementia is pet therapy. There's specific dogs that will go into, various facilities, or sometimes you can register for it for home care. Pets are great for literally everything, I think.
If your mom wasn't a dog person, I don't think all of a sudden she's going to want to be around dogs.
For the most part,
if she always loved dogs, pet therapy would be a great option.
Yes. Just trying to keep a sunny environment, happy pictures of happy things, pictures of things that were common in the past that maybe were funny, or, things like that, is super important. But there's a lot that you can do to help your loved one if you think that they're starting to experience dementia. And I think the first thing you need to do is, again, take them to the doctor, because there could be something else going on that could be reversible. That's the first reason why, because we did talk about reversible dementia. Again, medication side effects, pressure in brain, hormone imbalances. A person's confused, a hormone imbalance can cause that. Getting that checked and making sure that all those thyroid levels and everything is right in an elderly person, and that, you know, they're not off that way, and then they're fine, you know. A vitamin, again, a vitamin deficiency, a simple solution. Specifically, I want to say vitamin D and vitamin B are the common ones.
And also, we've seen a lot UTIs, where a UTI will bring someone who's like almost completely cognitive, can sometimes bring them down to where you're like, oh my goodness, what happened?
Or
to
any bacterial infection, even an illness, even like getting a cold. Sometimes for an elderly person, it'll get them confused. They'll get really confused, or a virus, they'll get really confused. You know, just pre-onset of symptoms, and then they come down sick. But we see them make a recovery. If they don't have dementia, we see them make recovery pretty much close to baseline or right at baseline when they do start to feel better. So, you know, Tracey and I so we're not doctors, and please don't think that we are. We're just CNAs and med techs, and I know you're never just a CNA, but we are the first people to notice a change in the people that we care for, because we're with them the most, just like any caregiver.
Right.
You know, if you're a caregiver and you're caring for somebody at home, you're gonna be the first person to notice these changes, admit to them, and get it looked into.
Right.
Because especially, like, you know, if it's a medication side effect, it's just such an easy fix. And I know, and I can't even say how many times medication adjustments or adding a vitamin or an antibiotic because of an infection have helped people. And you know, if you have a caregiver tell you, hey, you know, you need to, maybe you're not the primary caregiver, maybe you have somebody coming in your house to help, you know, with an elderly relative, and they notice a change right off the bat, get your family member looked at. Again,
sometimes you can have someone who you might be living with a person and you don't see the changes because they happen slowly, but someone comes to visit and they notice, hey, this isn't, you know, what they normally
how they were
behave
2 weeks
like.
ago.
Right. Don't just write that off.
Yep.
Get it looked at.
It's so important. Early detection is key. And, you know, I want to raise as much awareness and advocacy as possible. That's the whole point of this podcast, is to talk about, you know, what really goes on, what people really see, real experiences. Again, advocacy and awareness, because there's just, it's, especially for dementia, I feel like that's something that everybody knows it exists, but a lot of people don't even know how to respond to someone with dementia. And I'm going to tell you all a secret right now about how to respond to a person with dementia like a regular person, because it's what they are. Right?
I mean, we've had people come to us asking, you know, where's my baby? Where's my baby? And, you know, they're 90 years old. You know that their baby is all grown up.
Yeah.
And you'll be like, oh, it's okay. They're with the babysitter right now. We'll get them later.
Exactly. And yeah, you have to go into their world a little bit. Tracy's great on that.
You don't
but you don't talk to them like
100% lie. But yeah, but right. You just gotta
enter their world.
We've had people ask us for buses. Where's the bus? Where can I catch the bus?
Oh, the bus is
coming
later. You know what?
The buses aren't running today.
Yeah.
Because of the snowstorm. It could be the middle of July. They won't know. You could tell them there's a snowstorm coming. They'll be, oh, okay, so when's the next one coming? You know what? We'll let you know.
I worked on a dementia unit, and it was July, and we had a male patient, and he was trying to leave, and I told him he couldn't go because we had a really bad snowstorm coming. I'm like, you can't go. There's a really, really bad snowstorm coming. I'm like, there's like you can't leave. I'm like, you're gonna get stuck. I'm like, they're asking everybody to just stay here. I'm like, we got a bed for you. We got food for you. I'm like, you're all set. Not even a minute later, another male patient with his jacket on is going up to the door trying to get out. And this male patient comes right off to the side and goes, oh, he goes, I hear it's getting pretty bad out. You might want to hang out here. He goes, I hear they got room and they're going to be bringing us food in a little while. He goes, oh, that's a good idea. The second male patient goes back in his room, takes his jacket off. I was like, oh my God, my job was just done for me. Thank you.
Sometimes it's hard not to laugh at certain situations, and other times you feel like you want to cry.
Yeah.
But sometimes there are things that are just, we're not laughing at the person.
We're not laughing at the person.
Laughing
we're not
more
laughing at the disease. We're laughing at the situation. And like, I think for caregivers, take it to heart, and please take this one piece of advice to heart if you take anything to heart. Take everything lightly. Don't take things so serious all the time. Take it with a grain of salt, because sometimes, as difficult as it can be being a caregiver, and believe me, I know personally and professionally how difficult it is, and I know how much you want to just shake your family member and say, hey, I know you're in it, and you have to just kind of make the best of it and take it light, and once in a while laugh, because when you start laughing and you're calm, your family member is going to laugh and they're going to be calm. And that's so important. And another, it's okay to get help. If you need help, it's okay to get help with your loved one. Don't put that whole burden on you.
Don't ever feel like, if you end up having to put someone in a home, don't feel like you're abandoning them. You're not.
No.
Don't feel like you failed. You haven't. It's just sometimes things get really hard to deal with by yourself.
And some people with dementia need full 24-hour skilled nursing care. And a lot of people at home cannot provide that. And that's completely reasonable. And another thing, it's okay to take a break, and it's okay not to be okay.
Right. I know of places that will take someone for respite. They'll take them for like a week while you go on vacation. So, you're not burdening a family member, or you're not leaving this person with a stranger that would just be in your home. You're leaving them in a facility where they're going to get fed, where they're going to be clothed, where they're going to be safe.
A lot of facilities do that. Respite care for dementia is getting easier and easier to come by, or it's getting more readily available, I should say. Families, as dementia gets more common, we have more people who are able to help, which is a good thing. Also, if you do get in-home respite care and it's from an agency, another piece of advice I would give a caregiver is to get a camera, like a nanny cam or something. I'm not saying you can't trust all healthcare workers or all caregivers that are coming in, but if you're nervous about that, that's a good way to get peace of mind. I know my mom does have cameras for my grandmother, and I don't blame her. Yeah. I know at some point I'll be getting respite care for Joey, and when I do, I will have cameras. If I'm leaving him home with a person I don't know that well, which honestly I've never actually done. Other than him going to school, I've never left my children with somebody I don't really know that well, or even with a babysitter that's not a close friend or a family member. I'm very weird about that, but and that's me, and that's how I feel.
You just want someone you trust, and someone who knows the situation and won't get frustrated because they know what's going on. you can't just expect some person who doesn't have training, doesn't know what's going on, doesn't know who this person is to be okay.
And I do want to do pretty soon, I don't know if I'll put this on here, but pretty soon we do want to do an episode on caregiver burnout. I think I haven't gotten there yet, and I know how
especially with the current crisis.
Yep, that's gotten a lot worse. So with all that, Tracey, it was a pleasure to have you on.
It was great to be on the podcast today.
You can find us on, or you can find and my husband, and maybe I think I should have Tracey back. Let me know if you think I should have Tracey back. Tracey, you want to come back?
I mean, I wouldn't be opposed to it.
Tracey's coming back. I don't know when yet, but Tracey will be back. So thank you very much, Tracey. I really do appreciate you being on here. It was great to have you to bounce back, especially with you and I having so much experience with dementia and being caregivers. I want to thank Tracey. I want to thank our listeners in Singapore, by the way. I recently discovered that we have a listener in Singapore, and that's exciting. We also have a listener in Ireland, Australia, and Canada. So thank you guys, and thank you to all of our American listeners as well. I'm grateful for everybody that listens. It means a lot to, hopefully I'm helping somebody. Hopefully, my story, my experiences, and what I'm sharing is helpful to you. You can reach out to me. I would love it. I love feedback. I love interacting and saying hi. You can find me on Instagram, Caregiver Chronicles 2, on 1, Facebook, Caregiver Chronicles. You can also reach out to us via Anchor app, where you can listen. It's a podcast app where you can listen. And on Anchor, you can leave us a voice message, and if I like it, I might just put it in an episode. Or if you have a question, you can put it on there, and I'd love to do, like a Q&A pretty soon. So we'd love that. That's how you can reach us. We are going to build stuff. We thank you again for listening, and we'll see you next week.